Hello and good afternoon, everybody. How are you today? Hope well. Just wanted to do a class today on something that is happening just today. Well, not just today, but it's starting today. So it affects everybody in California, so it's important that we go over it as well. Um, so because there have been rise in infection rates for COVID-19 or the new variant of COVID, the Omicron, California has gone back to a new universal indoor mask mandate. So indoors, masks are mandated. So let's go over what this means for everyone. So in a surprise move, Monday, California state officials announced that the state is instituting a universal indoor mask mandate. Effective Wednesday, December 15th, which is today. The current mandate will run through January 15th. Oh, that's good to know. I missed that part on the news last night. So this is the Director of Health and Human Services, Dr. Mark Gailey, saying that we will require universal masking in indoor settings statewide. Noting that the order will cover roughly 50% of California's population not currently under such a mandate. So 50% right now of California is not under any mandates because things have been better in certain counties. But the rates are getting a little bit worse, so now they're going to pump it up to 100%. So Gailey goes on to say, we know people are tired and hungry for normalcy. Frankly, I am too, even though his name is Mark. So Mark Lee, he is too, sorry. That said, this is a critical time where we have a tool that we now know has worked. We are proactively putting this tool of universal indoor masking in public settings in place to ensure we get through a time of joy and hope without a darker cloud of concern and despair. So the state will also tighten restrictions on unvaccinated people who attend indoor mega events of 1,000 people or more, requiring them to receive a negative COVID test within 1 day of the event, even if it's a rapid antigen test, or within 2 days for a PCR test. I should know what that is, then I don't. Current rules require tests within 72 hours of the event, so that's also changed. Yeah, well, that's within 1 day of the event period. So the state is also recommending, so this is not a mandate yet, but not requiring that people who travel to California return to the state after traveling be tested for COVID within 3 to 5 days. And honestly, that's just safe to do. You know, if I went back home and came back here, I would definitely get a test. That's what I did. I did that before I went, long time ago, almost 2 years ago, and I did the same when I came back. You know, I want to make sure I'm okay. You know, I don't want to spread the disease, but I also don't want it, and I don't want to spread it. So current state guidelines, which are followed by many counties, include Riverside, Orange, and San Diego. Say masks are not only required indoors at public transit facilities such as airports, healthcare settings, adult and senior care facilities, schools, correctional facilities, houseless shelters, emergency shelters, and cooling centers. The new order extends the requirement in those counties to movie theaters, retail stores, restaurants, family entertainment centers, and government offices that serve the public. So Los Angeles County, so LA County, already has a mask wearing mandate at indoor public facilities. So that's already happening in LA, because I'm guessing the rates there, because it's a big place, might not be the best. Now, the state currently requires mask wearing for unvaccinated people at indoor public facilities, but the new rule will apply to everyone regardless of vaccination status. So Mark Galey also noted on a hastily arranged conference call with reporters that the state had seen a 47% rise in case rates since Thanksgiving, from 9.6 per 1,000 cases to 14 per 100,000. He also reported that local hospitals are seeing patient levels significantly above their baseline for this time of year. Wow, so that is pretty significant. So, but again, it's above their baseline for this time of year. I'm wondering what this really looked like compared to last year, but still, we know it's not the best, and we want to get back to normalcy. So he continued, we know that we're entering into a pretty hard time, that we're starting to see some of these numbers come up pretty quickly in some communities, and masking is the common sense thing to do. So infections are not spread evenly across the state, he said, so it's not everywhere. It's kind of like the U.S. There are some states that are like in worse spots, and some states that are in pretty good spots. But California is so big that it's kind of broken. But there are some counties that are well above our average in case rates. That could mean serious challenges to those communities. Many of those communities are also among the least vaccinated. And with people traveling, I can kind of see how, they're moving in this direction for right now. He pointed to rising infections in Riverside and San Bernardino, Inyo and Mono counties, and the Central Valley, as well as in northernmost parts of the state, such as Humboldt, Del Norte, and Mendocino. It's funny because Humboldt is, well, the whole county is, never mind. I was going to say it's, the college up there is very liberal. I mean, I went there, I should know, but actually it's a logging town, and so there's a lot of conservative people too. It's actually a nice mix of people. I actually like living there because it wasn't one or the other thing. Last winter, the state saw about 28,000 deaths related to COVID between November 20. So here are the numbers between November 2020 and February 2021. The Health and Human Services Director said officials are hoping to avoid a repeat of that tragedy. So here he goes again with this frankly, but frankly, with Delta and Omicron and the more rapid replication, we're seeing people who, if they do become severely sick, they are becoming sicker sooner. So we don't have nearly as much room as we did last year to make adjustments. While Delta still dominates, the state has identified 13 instances of the Omicron variant, including some, that's underlined for some reason, that appear to be via community transmission, as opposed to those people who are infected abroad before traveling here. So that would mean more among the people that you're already around, as opposed to traveling and getting it from somewhere else. So the California order was announced on the same day that New York State's indoor public mask mandate took effect. So according to NBC, similar orders have been issued in Washington, Oregon, Illinois, New Mexico, Nevada, and Hawaii. I'm not surprised that Utah's not in there. When asked whether the measure was a first step, top other increased restrictions, Galey said. Absolutely not. Wait, when asked whether the measure was the first step, no, to other increased restrictions, he said no. When asked about the enforcement of the mandate statewide, California's top health official acknowledged that some venues will adhere to the order more strictly than others. But he emphasized we're expecting Californians to heed the warnings and mask up. So mask up, everyone. And that's kind of where we're at right now when it comes to the updates on the masks. One thing that should be noted is that really the rates from different sources, you get different ideas. But I'd say throughout the country things are a little bit more stable. California's having a bit of a rise, but throughout the country things are a little bit more stable. I think what's happening is that we want to make sure that as we get through the holidays, if we can kind of keep the rates under control so they're not spiking really badly as they were before, then next year is going to be a much better year, and we're going to be able to start opening things up. So here's to that. I hope we can start opening things up. All right. Ciao for now. If you have any questions, please feel free to ask. I will do any research you ask me to do, but please ask questions. I like questions. Thank you.